I'm Dr. Minal Chandra, and I'm the co-founder and chief consultant at Epione Pain Management Center. A lot of patients will come with shoulder joint pain. So they have shoulder joint pain, and then eventually over a period of 1 month or 2 months, the joint movement starts becoming restricted. And they think that this is going into frozen shoulder, and then they start some physiotherapy, and then the pain increases, and again they are in a state where the pain becomes very excruciating and the joints movement are completely restricted. So now this could be frozen shoulder, but every frozen shoulder will have a reason. Every joint will have lots of structures, and shoulder joint is a big joint with lots of muscles, lots of tendons and ligaments around it. So we need to identify what is the reason for frozen shoulder. The most used technique of identifying the correct reason is by doing a high resolution ultrasound. So in high resolution ultrasound we can do dynamic movements. So like when you raise your hand, or when you do different movements of the hand, different ligaments and different muscles will be active. So during rest and during movement, what is the damage, what is the extent of the damage can be identified by doing this scan. Once we do this scan, we can identify, is there a tear in any of the rotator cuff muscles. So there are 4 rotator cuff muscles which give stability to the joint. So you can identify, is it because of the joint, whether there is a rotator cuff injury, and if there is an injury, in which rotator cuff there is the injury, and what is the extent of the injury. Whether this is coming from joint. So we have 2 joints, glenohumeral joint and acromioclavicular joint. So we identify if there is any joint diffusion, if there is fluid in the joint, or there is other changes in the joint. Third thing is, we can identify whether it is a shoulder pathology, or whether the pain is coming from spine, or whether it is because of the muscles above it. So doing a high resolution ultrasound scan and examining the patient is very, very important. So make sure that your treating doctor is doing both of this to identify what is the reason of your frozen shoulder. Now there are some metabolic disorders like patients with diabetes or patients with hypothyroidism who are more prone for getting into this frozen shoulder. So you need to keep a check on these medical conditions as well. And after this you can plan a protocol where we can treat this frozen shoulder and any injury in the rotator cuff using multidisciplinary management. So you need to see your pain physician. They will plan a protocol followed by a good rehab. So treating the cause of pain and strengthening is equally important, and it goes hand in hand.